nerve roots. So the patient will come to the doctor with the complaint of neck pain, and if it is due to nerve root irritation with the pain radiating to the ipsilateral upper extremity, the doctor will try to see if the patient have a cervical disc herniation with irritation of the nerve root. Keep in mind, the cervical spine problems and shoulder problems overlap. So the doctor will examine the patient carefully, and each nerve involved will show its effect on the motor power, the sensation, and the reflexes. So let's take two examples, C5, C6, and C6, C7 disc herniation. So each level will get the nerve at the lower number. For example, C5, C6 will get C6 nerve root. Here you can see the sensation affected, and it will also affect the wrist extension, which is C6. The biceps is really C5 and C6 together, but the wrist extension is probably the best for C6. The reflex will be the brachioradialis reflex. Let's take C6, C7 disc herniation will affect C7 nerve root. Usually the sensation involved is the middle finger. The motor will be the triceps, and you can see here that letter 7, the wrist flexion and finger extension. And the reflex will be the triceps reflex. But there are some other tests for cervical radiculopathy, which we call it provocative tests. One of them is the Spurlings test, and that's clearly used to assess cervical nerve root pain and impingement. This is how you do the test. The clinician will stand behind the patient. The patient can be sitting down or standing up. So you'll have extension of the neck, the lateral flexion of the neck, and some rotation of the neck. The head of the patient would be tilted towards the affected side, and then you apply the axial compressive force. And the positive test will reproduce the pain in the upper extremity when the compressive force or the load is applied, and it will cause radiating pain down the patient's arm. And that will be attributed to the nerve root impingement or compression on the same side, the ipsilateral side. There's another test called the shoulder abduction test. In the shoulder abduction test, the patient's symptoms are relieved by shoulder abduction by placing the hand over the head. And this test helps to differentiate between cervical spine pathology and other causes of shoulder pain. It is an important test for cervical radicular compressive diseases. The relief of the symptoms occurs due to decreased tension on the nerve roots. If there is relief of symptoms by shoulder abduction, then the cause of shoulder pain is not a shoulder pathology, but it is probably the pain coming from the cervical nerve root pathology due to nerve root irritation. This patient with cervical nerve root irritation could be treated conservatively up till 3 months with therapy, non-steroidal anti-inflammatory, and 75% of them will improve with non-operative treatment. When do you do surgery? If the patient has persistent pain for 6 to 12